COVID-19 is an infectious disease caused by a new strain of coronavirus called SARS-CoV-2. People can catch COVID-19 from others who have the virus. The disease spreads primarily from direct contact between persons through small droplets from the nose or mouth, which are expelled when a person with COVID-19 coughs, sneezes, or talks. These droplets containing the virus can also land on objects and surfaces around the person, such as tables, doorknobs, handrails, and cell phones. People can become infected by touching these objects or surfaces, then touching their eyes, nose, or mouth. Contact tracing means finding everyone who comes in close contact with a person with COVID-19. Contact tracing is an effective public health intervention to stop the spread of COVID-19. People in close contact with someone who has COVID-19 are at high risk of becoming infected themselves and of potentially further infecting others. By rapidly detecting cases and identifying close contacts, reporting and monitoring them, isolating and treating those who develop symptoms, public health aims to reduce infections in the population. Speed is the key. As soon as we get minimum data of the cases, we can start contact tracing. Contact tracing involves 3 major steps. Step 1. Identify and list close contacts. Upon identification of persons with COVID-19 or those who may have COVID-19, close contacts are rapidly identified. Close contacts can be anyone who has been exposed to an infected person, family members, work colleagues, friends, healthcare providers, or the community. Step 2. Inform and profile close contacts and manage amplifying events. The identified close contacts are informed about the process and rationale for contact tracing and information on quarantine, where they will be quarantined and how they will be cared for, what symptoms to look out for during the monitoring period, what to do if they become unwell, and any other query or concern raised by the close contact. Announce settings, places, and gatherings where the suspect, probable, and confirmed cases have been in the past 14 days. Advise people to avoid these places, settings, and venues. Advise those who were in the same event or place as a confirmed case to self-monitor and contact their local health authorities if signs and symptoms appear. Step 3. Manage and monitor close contacts. We quarantine rapidly all close contacts without symptoms, ideally in community quarantine centers. We monitor their health condition and provide management and care as needed. Daily follow-up for 14 days should be conducted with all close contacts to monitor for signs and symptoms. We isolate rapidly close contacts with symptoms. They should be assessed, monitored, and referred for testing as needed. Contact tracing aims to detect, report, monitor, isolate, and treat cases quickly to prevent the spread of infection to others. Missing even just one case from close contacts will allow transmission of the disease to others, resulting to more cases and lives lost. Contact tracing is an important public health intervention to effectively prevent large-scale community transmission. Remember, as soon as we get minimum data of cases, we can start contact tracing. Speed is the key. Let's stop COVID-19 transmission now. Detect, report, monitor, isolate, treat. It is our most urgent action today.